How many of you in this room have ovaries? Well, even if you didn't raise your hand, I bet you know at least one person in your life who does. Approximately half of the world's population consists of individuals that have ovaries. And guess what? Ovarian cancer is actually the deadliest cancer that affects the female reproductive system. And among this, there's a certain subtype that accounts for 5 to 10% of ovarian cancers called low-grade serous ovarian cancer. Now, even when these patients go through standard treatment, which involves surgery to remove as much of the cancer as possible, followed by chemotherapy, approximately 80% of these patients have the cancer come back. And here's the tough part. When it does come back, there is not a proper treatment plan that works well for all patients. And that is because we still don't fully understand what is happening inside of this tumor. But we do know something important is being activated, a signaling pathway that seems to drive the tumor's growth. You can think of this signaling pathway like a stoplight. When the light is working properly, it turns red, green, and yellow and keeps the traffic flow under control. However, in the case of cancer cells, the light is faulty and is stuck on green, which means the signal to go never stops. And the result? Well, the cancer cells keep growing and spreading. To address this faulty signaling pathway, scientists have developed certain drugs called inhibitors, which are designed to block these constant go signals. While these treatments have worked effectively for other cancers, they are not as effective for patients with low-grade serous ovarian cancer, as they all eventually seem to die. So the question is why? Why are these treatments not as effective, and why do they stop working over time for these patients that have the cancer come back? That is where my research comes in. My focus is to figure out how these cancer cells are becoming resistant to these drugs or treatments over time. You can think of this like a predator and prey situation in nature. Imagine a predator lion, or the treatment inhibitor, hunting the prey, or the herd of goats in this situation, or the cancer cells. At first, the lion is able to get to the weaker and slower goats. But over time, the smarter and faster goats get away, they escape, they adapt, and the lion can't get to them anymore. That is what is happening with these cancer cells. They learn to survive and adapt, and ultimately outsmart the treatment. To study this phenomenon, I use cancer cells derived from patient tumors and treat them with these same inhibitors. Over time, the resistant cells, or the cells that outsmart the treatment, emerge, and I investigate the genes that are being turned on or off within them. This work is the first step towards uncovering why these treatments are becoming less effective, and this can ultimately give patients with low-grade serous ovarian cancer better outcomes in the future. Thank you.